There are a number of ways that you can support your teen's physical development. One way is to support their involvement in physical activities like sports, walking, hiking, swimming, arts, crafts, those things that continue to refine their small motor development, learning to play musical instruments, etc. When you engage in these types of activities as a family, and if you do it before they become teenagers, it's a lot easier to continue it afterward, although there are times your teen may not want to continue doing it as well. Be flexible with your teen. Remember that they're becoming more independent, and your support of that increase in their skills can help increase their confidence. You could talk to your teen about the changes that are happening in their body. Be sure you have accurate information so you provide your teenager with good resources. If you're not sure, and this is a really complex topic, you could always reach out to an agency that specializes in information about sexual maturity. They can provide information about what's happening in your teen's body, how to support their physical development, ways to have a positive self-image, and just ways to ensure their positive transitions to adulthood. There are also several things that you can do to support your teen after trauma. Teens who have experienced traumatic events throughout their lives are more likely to experience anxiety and depression during the teenage years. You could help your teenager to understand that it's a normal response to trauma, and that's not their fault. You could practice mindfulness together, do breathing exercises, use mind-body bridging to calm both of your brains. And, you could also think about other things that support you and your teenager in decreasing anxiety and depression. Some teens like to be really active, and that helps to calm their brains. Other teens like to engage in writing in a journal, and they find that supportive. And of course, a big thing teens like to do is to talk to their friends. If by chance your teenager needs some sort of treatment, you could reach out for cognitive behavioral therapy education and resources so that you could decrease cognitive distortions. You could also ask about dialectical behavioral therapy, which is another evidence-based treatment for trauma. So both of those treatments have been found to decrease symptomology after a person has experienced traumatic events. It can be really hard to realize that your teen might prefer to talk to their friends about the situation, but sometimes that's exactly what they do. And what we could do to be helpful is to honor that need. You could talk to your teenager about potential trauma reactions and help them to know that these different responses are normal. They're just normal responses to abnormal events. There's nothing wrong with them. Their body's just trying to cope with what they have been experiencing. Let them know that every person responds differently to trauma based on their own genetic makeup and what they've experienced during their lives. And there's not a wrong way or a right way to recover. If they talk to you, listen to your teen's experience and normalize and validate their feelings. This was something that's very hard for them. You're here if they need to talk, to be held, or to just be. These things can calm down the physical symptoms of trauma that your teenager might be experiencing. You might watch your teen for changes in their behavior and talk to them about what you see. Tell them you wonder whether it's related to what happened, because maybe they're still thinking about it. Let them know that you're there for them and you understand that it's hard. Again, this can help them to begin to settle their mind, to feel supported, and to help them be able to relax a little.